So Ludlow Street Healthcare is an independent health and social care organisation. We operate 19 sites across South Wales mainly, but we have 2 sites in the Bristol area. We provide health and social care services for people with varying needs. Particularly client groups that we offer services for include people with complex mental health problems, people with autism, people with a learning disability, and people with dementia and other neurological conditions. So I think we're entering a period of substantial and probably transformational change in the mental health system at the moment, in particular in the areas of person-based care, rights-based care, and I guess a much greater focus on working with people rather than using what has been in the past a somewhat paternalistic model of mental health care where people really haven't had that much say in the treatments that they've been offered, particularly when they've been detained under the Mental Health Act. And maybe haven't necessarily been asked their opinions about the quality of the care that's been offered to them. So I really think the next 10 years is going to see a substantial shift in the approach that we take across the whole system. So we've been particularly excited about the recent Together for Mental Health policy developments and have submitted an organisational response to the recent consultation on that. We've also been involved through the Challenging Behaviour Community of Practice in the development of the new restrictive practices consultation. And from the point of view of the points that I talked about earlier in relation to person-centred care and rights-based care, we feel that these new Welsh documents really give Wales the opportunity to be a vanguard really in the delivery of a new type of mental health system that really puts people at the heart of their care and perhaps does things differently. And obviously as a progressive organisation, we felt it was important to encourage those changes. So a lot of highlights from the conference today. Really exciting conference, lots of new ideas, lots of, as I've used the word before, transformational ideas really about the system. Things that have been particularly exciting for me have been hearing about some of the really important quality improvement work that's been done in the Bridgend locality, where they've taken a very bottom-up approach to improving quality in their inpatient services. I think there are a lot of lessons for all of us from the work they've done there. Also colleagues in an Aneurin Bevan Health Board talking about the way that they've scaled up their offer for psychological therapies for people with really complex needs, I think is a great example of creative service development. And finally, Dr. Alex Sturziker's talk on the changes that are being made to the community mental health offer across England, I think really align quite well with some of the changes that are happening in Wales. And I feel there's a really good opportunity there for lots of kind of cross-fertilisation of ideas between Wales and England with the overall aim of improving the system and improving people's lives.